Hi guys, it is X. I am back today with another nursing video. Today's topic is going to be time management, and I feel like this is something when you're in nursing school, you're always told you have to go to a med-surg floor so you can learn time management and then advance, which simply I do not believe is true. Sorry to burst everybody's bubble. And I also apologize for my lisp. I have Invisalign and I still have not gotten used to it, so bear with me. But anyway, yeah, today I want to talk about my time management tips, what I find helps work for me. I've never gotten out late in the 4 years that I've been a nurse, and I'm very proud of that. But yeah, if you guys want to listen to my tips, just keep on watching. And before you swipe me away or click me out of this video, please like, comment, and don't forget to hit the subscribe button. Thank you. Okay, so I started on a DOU floor where I had 3 patients, and I realized that this is probably not going to work for all units. I had to, as an agreement, in order for me to get ICU trained at a hospital that I worked at before, they wanted me on telemetry for, I think, a couple months, and it terrified me. Anything below PCU where there's no monitors, and some PCUs don't even have monitors, terrifies me because I'm so reliant on being able to see all my vitals, and not being able to see those things gives me palpitations. I'm not gonna lie, like that telemetry and med-surg has always been scary to me because of that reason. So when I worked on tele, I honestly feel like I got just faster and stronger, and I had to learn how to think more critically, because if something did go wrong where I had to call rapids, I was not reliant on being able to see trends every hour from these monitors that I was so used to having and backing me up. So I think having more patients on tele and just dealing with all the admissions and discharges just made me a lot faster. But now I work in the ICU, and I just kind of wanted to show you my brain and how I split up my day and why I do the things I do and how it has helped me always get out on time and be able to help other people. So these are my tips and tricks. So first I'm going to start off with my brain. I'm sorry, it's all crinkled because it's been in my backpack, but it is just a simple brain that somebody had given me, and I kind of just tailored it to the ICU. So here is my main report. I did work trauma mainly, so I always have this little man so that I can quickly write down what injuries there is to the patient, and then up here I do my labs, and down here I do a to-do list. So I do a to-do list for main reasons. I like to tell my patients what the schedule is, and the reason why is because when I was a new grad, I was still working with my preceptor, and we had a patient that complained that I was never in the room, and I was like, that's just not true, but okay. And then so the next day I was in there a little bit more often, and then the patient complained that I was in there so often that I didn't let her sleep. So I was like, okay, I have to find a healthy, happy medium with this. So what I decided to do was write down my schedule of everything we're doing. I'm talking labs, medications, blood draws, whatever, procedures that we're gonna do. Mainly I work nights, so at this point we don't really do a lot of procedures at the DOU that I was working on, so I kind of just liked to develop a list. And also by developing this list, another thing that I had realized was that I would go and depend on either the Pyxis or Omnicell, whatever you're using, to tell me when my meds were due. So I would go get out my 8 o'clock meds, run to my rooms to scan them, and then realize I was missing some. They weren't all there, or there was something that was in the Omnicell that was just not at the set time. And I was frustrated because now I have to go all the way back to the med room, get the med, and then bring it back. It was just a waste of my time. So to me, writing things down just helps me tremendously. So at the start of my shift, what I do is I get report from 7 to 7:30. Now in the ICU, we only have 2 patients to get report on. However, there is a lot more going on. So even though people do not like to do bedside report, I am a very big advocate for bedside report. It has honestly personally saved me a couple of times from nurses trying to pin things on me that exactly I knew did not happen on my shift. For example, I had a patient once who was on amiodarone, and when I came back from report, the nurse told me that my IV was infiltrated and my amiodarone wasn't working, and I was like, bull crap. you and I, during shift change, during report, we're standing at the bedside, we traced the lines together, and that IV was not infiltrated, and my patient's heart rate was in the normal range and controlled. So I know for a fact that infiltration did not happen on my shift. So this is just one of many examples why I do love bedside report. I understand that people don't like to do it because, not right now because of COVID, but they're hesitant because there's family that ask a lot of questions, or the patient has to go to the bathroom, and it's like you only have this 30-minute time frame. And if you work on a floor, I'm in California, so we have only 5 patients on our med surg floors, but if you work on a floor with 5 people, that is a lot of stuff to get through. So I can understand your hesitation, but I highly suggest you getting used to doing this routine and getting bedside report. Another thing I like to do is I like to introduce myself to the patient and saying, hi, I'm Christina. I'm going to be your nurse today. Please give me 15 to 20 minutes to look over your labs, medications. I will be back and I will tell you what we're doing today. That is my speech that I tell every single patient. If they're intubated, it's a little more difficult, but you should be talking to your intubated patients. So that is what I do. At the beginning of the shift, that's exactly what I do from 7 to 7:30 is get report, look at my labs and medications, see what we're going on. I like to read all my diagnostics, read my doctor's notes if I can, just to see what our plan is. Especially in the night shift, I felt like I never knew what the plan was. So now that I work day shift, I make it a point to tell the nurse at night what our plan is. Why is this patient still here? One thing I did not like working at night was that I never knew why. I felt like these patients were here for weeks to months, and I was like, what are we doing here? Like, why is this person still here? So I like to make it a point to write it down and pass it along so that we do know exactly together, a better communication, why we're doing what we're doing. So like I said, that's what I do for the first half hour. And then now the next tip I have is something that's probably gonna, I don't want to say blow your mind, but what we're taught in school is to always check your unstable patient first, right? That's what they tell you. I exactly do not agree with that. So I will go to my unstable patient and just see that they're stable. That's exactly what I'm gonna look at. And then I will go to my unstable patient and see how they are. However, depending on the situation, depending on what medications I have, I might not exactly go tend to that person first. Or you kind of have to get to know your patient's personality, because if they are a very needy patient where they're calling all the time, they might not be the person that I go to first. So you kind of just have to assess the situation. So for me, after I'm done writing my meds down, I will kind of analyze who has meds first. I try to bunch my meds if I can. So the only time I usually cannot do this is if I have like Lantus scheduled at 9:30 or 9 and then insulin at 10. Like, it bugs me when they do this, but that's just how it goes. So usually I try to bunch my 9 and 8 o'clock medications together. Unfortunately, if I have Lantus, some hospitals, a lot of them, there's certain drugs like antibiotics or insulin that you cannot give before a 30-minute time frame. Or like insulin, you should not give the insulin 30 minutes after you have checked the sugar. So for those instances, I do not bunch those drugs together. However, I love to chart as I go. That is another tip. Clean as I go, another tip that I have when I start off my day. So I will go to my least stable patient, my most stable patient first, depending on their personality. Like I said, if they're not very needy and I know they're not going to call me or want to chit chat with me and ask a million questions, I will go to them first. Why? Because I can knock out their assessment, their 8 o'clock charting, and their 8 and 9 o'clock medications very, very quickly. So if I know that my unstable patient is going to require me more time, and something that I like to do is, especially if I was on nights, I would go and set up everything. If I needed new NS bags for my TKOs, or if I needed a new NS bag for my arterial line, or just new suction canisters and I knew I was going to do a bed bath, I like to set that up all at 8 o'clock when I first walk in the room. So the first thing that I would go do is go chart within my rooms. And okay, I understand you want to chart at your desk, but to me, I love to develop a rapport with my patients, and I feel like for time management purposes, you can go in the room, do your 8 o'clock charting, so your vitals, talk to your patient, assess them, get to know them, talk to them. Like, you will get a good baseline neuro assessment while you speak to them. So after that 8 o'clock charting is done and I knock off those medications, I will go to my unstable patient, and that is when I will wipe down the rooms, clean everything. I wipe down everything that I'm going to touch. So any counter, the computer, the scanner, the bed frame, the Foley, like, I will wipe all of that down with the Sani wipe so that I know that if I touch it and I happen to not have gloves on, I'm still safe and still gonna wash my hands. But I don't know, I just like a clean room. Clean as you go. So anytime I open a medication, I'm by the trash can. You peel that syringe, package off, you throw it away right then and there. Like, I don't know, when I first got hired as a new grad, I worked at a hospital that was for profit, and one thing that they were really big on was HCAP scores. They actually told me to research it because they were going to ask me questions in my in-person interview. So what I did was I went home, I made a whole plan for every single question on the HCAP scores, and one of the main, like, big things was cleanliness. So I just made it a point to, when I was interviewing for this hospital, to let them know how I personally was going to help improve those scores. And that was one of the things that I just stuck to, was cleaning as I go. It also, you don't have to do it later in your shift, and if things get busy, you never know when someone's going to code. You never know if someone's going to get combative, and you never know when someone else is going to need help. So I just like to be prepared for any situation, and I love assisting in codes. I feel like it just makes me better, smarter, and like a better nurse when I go to every code, because I just you learn something new every single time. So I always make sure that I am available for those situations. So after I do my 8 to 9s, I, like I said, I sit down. We have rounds. So at my hospital, we round at night and during the day. So I have to make sure that by 9:30, when we round, that I have all my stuff gathered, my information, and this is a perfect opportunity for me to clarify orders or ask for things that I need, whether it's a certain medication or procedure or just anything that I have questions for. I want to make sure I'm ready for those rounds. Also, just another tip, if you work night shift, I used to take my lunch at midnight just for dietary reasons, but I would always schedule my bed baths, because we bathe our patients every single night with these chlorhexidine wipes, you know, to decrease infection. And I always did them at 2, because that was like my crash time. I'm like, I am falling asleep, this is when I'm tired, and I like to keep moving, especially on night shift. Sometimes it is a little slower. Patients don't always sleep at night, but I would do my total care bed baths around 2 to 4. My patients that would move a little bit more and were able to turn easily, those patients I would do around 5 or 6, because they are able to assist you. So I'll let them sleep and do sleep hygiene as much as I can. But yeah, those are basically what I do to make sure I get out on time. Chart as you go. Write down your medications, because you don't want to have to waste time going back and forth or having to call pharmacy asking and wondering, like, when is this medication come? When is it going to be here? Also, learn how often and frequency you chart things, because every hospital is different. I've worked at hospitals where you just kind of chart the lines and IVs once a shift, and then I worked at hospitals where you chart these lines every 2 hours, or skin every 8 hours, like something crazy ridiculous like that. So you kind of just want to learn your facilities routine, write it down. You don't always have to write it down. I mean, there are some nurses that come in, you give them a report, and they're not even writing anything down. They're kind of just staring at you, and I'm like, wow, you must have a really good memory. But if you're a new grad and you kind of have no idea how you're gonna sort out your day, that is exactly what I do. So I'm kind of gonna go down my brain. I break it down: neuro, respiratory, cardiac, GI, whatever, and so on. Here's where I write my labs, and then here is where I write my medications. And one thing that I was just recently telling one of my nursing students is you don't necessarily have to write your labs down. However, if I am in rounds and I don't have a computer up and a doctor asks me something specific about a lab, I'm like, hold on, I have to wait and like open this. Some of them are not very patient. It depends on who you work with, but I don't want to keep this person waiting when there's a million other nurses waiting for you to give reports so that they can go next. So those are just my tips and tricks. I hope anything helps you. If you have any ideas or something that helps you, please comment down below so we can all help each other. Thank you for watching. Bye.